Are you or your physical therapist or the internet always blaming tight hip flexors on your various pains? Well, this is a test to determine if that's really the case or if it's really something else that's going on. So hip flexor's job is to flex your hip, so bring your thigh towards your rib cage. So if it were healthy, it should have a nice long amount of hip extension, which is what we're checking here. To do this test, you need to take a knee. Since we don't have the softest ground here, we're using this mat to ease pressure on the knee. But to do this, the person being tested, shoulders have to be over the hips, and you're going to lead with the front of your hip. So what May is going to do here is she's going to sink into a lunge best she can, as far as she can. And what I have is a simple ruler and a level. So I'm going to take the ruler and I'm going to slide it up to her knee. And I'm going to say, May, put your finger on the front of your hip. So that bone on the front of your hip, that is where I'm putting this level. So she's sinking down as far as you can. Can you go any further? All right. So I'm going to go to that finger. All right. And make sure the level is nice and level. And she is at 11 degrees. Or sorry, 11 inches. 12 inches is full range of motion. So it's like an A- level of function. If you were to complain about back pain, this would not be the first thing we look at. Because when you have that much function, it's very unlikely, unless you are particularly flexible, that this is the problem. So that's how you measure hip extension, which tells you how healthy your hip flexors are. 12 inches is 100%, A plus. Always measure both sides. And if you notice that this is very limited, then maybe it is a hip flexor problem. In all likelihood, it's probably not.